good amount of people who are here this morning. Good morning, everybody, or good afternoon or good evening, wherever you might be, any part of the world today. We're joining you, of course, from UC San Diego. This is our webinar on student health, immunizations, insurance, and immunization requirements, specifically for graduate students. My name is Gabi Hoffman. I'm the Assistant Director for Student Experience and Engagement at the International Students and Programs Office here at UC San Diego. ISPO is one of 4 units within the Division of Global Education at the department, which includes the International Faculty and Scholar Office, Study Abroad, and the Office of the Dean of Global Education. So again, today I'm joined by my colleagues who will introduce themselves shortly. We are going over insurance and immunization requirements for graduate students. I will go ahead first and pass this on to Shauna to introduce herself.
Hello, everyone. My name is Shauna Slabiota, and I work in the graduate division. Part of my role is coordinating new graduate student orientation. So I'm very happy to be here chatting with you all, and I can't wait to welcome you to campus in the fall or summer or whenever you're starting. I am also going to be presenting on a few items on the graduate admissions side of the house. And I also have an email address if you have questions about grad admissions, but I'll talk about that in a couple of slides. So thank you.
Thank you, Shauna. And then next we have Jill.
Hi, my name is Jill Batika. I'm the manager of billing and insurance here for student health and well-being on campus.
And lastly, we have Annie.
Hi, my name is Annie Horton. I'm the Director of Nursing for Student Health Services that oversees the incoming health requirements.
Thank you, Annie, Jill, and Shauna for joining us today. We have a great panel here to help answer your questions. So before we get started today, I just wanted to go over a few housekeeping rules, so to speak, here in our Zoom session. So all of you as participants are in listen-only mode, meaning you can hear us, but we cannot hear you. We do want this to be highly participatory, so we do definitely want you to ask questions. You can use the Q&A feature to submit questions. The chat function is disabled because we want you to use that Q&A function, so please go ahead and use that. You can also contact us at icontact.ucsd.edu if you have more case-specific or detailed questions. And then Student Health will also be providing their contact information if you have more case-specific questions at the end as well. And finally, we are recording. So this session is being recorded and will be posted on our website at iwebinars.ucsd.edu. Please note, it does take about 10 days for that recording to show up, but it will be posted there for you to go ahead and take a look at. So we are going to go ahead and get started. Just a quick review one more time here. Here's the control panel, our Q&A. You can see that box here for you to go ahead and use if you do have any questions. We are saving questions toward the end so that we can get through the whole presentation, but you can use that function and then we will get to those questions at the very end. All right. So today, again, we're going to be talking about some very important topics related to student health and immunization. But first, we're going to quickly do a review of the International Students and Programs Office, some helpful resources for you. As Shauna mentioned, there will also be some graduate admissions reminders for you to all consider. Then we will go over student health services and how they are here to help you as a student during your time here. Then Annie will go over immunization requirements for this year, and then we'll review some upcoming webinars and allow time for open question and answer at the end. All right, so first, some reminders, or this might be new information for some of our new graduate students. This is our ISPO website and our first steps checklist that we encourage all of you to take a look at as a newly admitted international graduate student. So if you haven't been here yet, we encourage you highly to take a look at inewstudent.ucsd.edu. This is a series of pages specifically for international students to help them get started once they've been admitted to UC San Diego. So as you can see here, once you go to inewstudent.ucsd.edu, click on graduate students, And you'll have your first steps outlined for you as a new student, specifically to do with how to request your immigration documents, such as your I-20 or your DS 2019. There's also a series of steps on how to prepare for arrival to the United States, as well as what to do once you do arrive. So highly recommend. There's a great series of checklists here that you can keep in mind to make sure you're meeting all of these before you come to UC San Diego. All right, and with that, I'm going to hand it over to Shauna to go over some reminders from the graduate admissions.
Thank you, Gabi. So I want to remind everyone that your application portal, this is your graduate application portal, can be accessed by visiting gradapply.ucsd.edu. I'm also putting a link in the chat. And it has a lot of helpful information for newly admitted graduate students. And in a moment, we'll also show you a screenshot of this page and point out a couple of things in particular that we want you to make sure to take note of. I also want to remind you that most students are admitted provisionally, and this means that you have to submit some official final documentation to our office for your admission. This is often final transcripts or perhaps official test scores that are that we still need to be able to see and verify within graduate admissions. There's a list of these documents in your portal, so I'll also talk about that when we look at the screen. I also want to mention that provisional admission should not impact your ability to get immigration documents. So please know that honestly, the majority of our students are admitted provisionally, and this shouldn't be a deterrent when trying to arrive and get your documentation and come to the United States. And if you have any questions about any of the admissions items that I talk about, if we don't have a chance to get to them in the Q&A or you think of something later, just go ahead and send a message to gradadmissions@ucsd.edu and our staff will help you out. Oh, perfect. Thanks, Gabi. So this is what your application portal looks like. So just a couple of things. Your UCSD PID is going to be available all the way in the upper left-hand section of the page. So that's where you can find it. If we continue going down that page, any updates to your application will be under status update. Any forms you need to submit, which might include, for example, the statement of legal residence will be listed here. And then all of the pending admissions documents that you need to lift your provisional admission, as well as information on mailing it to us or submitting these documents. The other thing I want to mention when we're looking at this page is on the bottom right, there's a highlighted section, and that's going to give you, that provides links, I should say, to a list of steps for admitted students that we'll need you to take care of. And I'm also going to put a direct link to the admitted students section of our website if you want to visit it right now. This is where you're going to find all of the dates and deadlines and tasks that you need to take care of as a newly admitted graduate student. So I'll be here, I'll be answering questions, at the end of the webinar. So I think that's it for me right now.
Thank you so much, Shauna, for those reminders. We're going to go ahead then into the main portion of our presentation, and I will hand it over to Jill to go over student health services.
Great, thank you, Gabi. I'm putting in the chat our website, just in case anyone wants to take a look at that while we're talking. I'm here again from the Insurance and Billing Department for the Student Health and Wellbeing Office. And my name is Jill. I hope you're all doing well and excited about coming to UCSD this fall, or when you do arrive. It is beautiful here and you're gonna love it. I'm here to give you some information about the health insurance requirement and the fee that you'll see on your registration charges and how that all works. So the University of California wants to protect you and our campus from any illnesses or injuries. And in order to do this, the Office of the President for the UC system dictates that all registered students have full and unlimited health insurance benefits that include mental health and hospitalization. The insurance must be centered and administered in the United States. Many students do not have access to insurance or the correct amount of coverage, so they do purchase the student health insurance plan, which we refer to as SHIP, and that meets the requirements, or they find a plan that does meet the requirements. The waiver criteria is on our website if you'd like to take a look at what is required. If you do have insurance that meets our coverage requirements and you want to avoid paying the registration fee, you can. You just have to act timely and have all the documentation necessary to verify your validity of your insurance. For those that need insurance and will opt to stay with the school offered insurance, you will pay about $1,370 per quarter as a graduate student for this academic year. This will provide you with unlimited insurance through a company called Anthem Blue Cross, and your primary care physician home is our Student Health and Wellbeing Center here on campus. We have over 30 primary care providers, x-rays, laboratory, and pharmacy services available to you with little out-of-pocket expenses. If you see one of our UCSD Student Health and Wellbeing providers, your visit, lab services, and x-rays are covered in full. The only copay that you would pay would be for a prescription medication, and that's based on the Anthem Blue Cross formulary, which you can find on our website. Copays are generally $5 for generic drugs and $40 to $100 copay for brand name prescriptions. This is cheaper than using a commercial pharmacy in the community, so you always want to come to UCSD Student Health and Wellbeing on campus where we can save you money. If you go to a community provider, you can do that, but you're going to pay a $10 copay for generic drugs and $100 for brand name drugs. We also sell over-the-counter items that you may want to purchase. You can buy those with a credit card and save lots of money. We have cough drops, aspirin, ibuprofen, thermometers, toothbrushes, and much more. So visit us and see what we have to offer you and purchase anything that you want with your credit card. If you don't pay at the time of service, it will be transferred to your student bursar account where you can pay it at the same time as your statement. If you do file a health fee waiver application and you are denied, you have the right to file an appeal within 5 business days of your decision. The appeal is offered to you as part of the denial notification from the company AHP, who is the waiver determiner. Send the appeal to me directly at Jill Batika, it's JBATTIKHA at health.ucsd.edu within 5 business days of your decision. And we will review this with the medical director here at Student Health and Wellbeing. And if you're approved, we'll communicate that to you via email. If you are denied, we'll explain why you have been denied. If you are denied, you will have to pay for the student health insurance plan, and you may waive it for the rest of the year if you do find a plan that meets your needs. I will email the findings to you, and in the event that you're mandated to stay in your home country, we will allow you to use your home country insurance, but hopefully that won't happen again for a very long time. If you do have questions about this, please contact my department by phone or email or attend one of our Zooms. So the students for all of the UC system are automatically enrolled in the SHIP student health insurance plan unless you waive out timely. When you file the health fee waiver application, you will be asked if you'd like to pick up a RAFT, and we'll cover that in the next few slides. Just remember to keep in mind you must adhere to the deadlines, as there are no exceptions that can be made. Once an insurance company is paid a premium, it is non-refundable, so we can't retract that or reverse those charges. We are here if you have any concerns or inquiries, and I will be answering any questions in the Q&A or chat that we'll see later. But just remember that you are automatically enrolled in the plan. You have to opt out of it. This year, the waiver time frame on the Triton link is from May 3rd to September 10th. And then it'll remain open until the 15th with a $50 late fee if you do file it then. The UCSHIP plan includes coverage for primary care, specialty care, diagnostic services, surgery, outpatient and inpatient hospital services, and full mental health benefits, inpatient and outpatient. The out-of-pocket expenses that you will pay are determined by who you go to see for care. The UCSHIP plan is a tiered plan that provides options for providers and facilities based on how much you want to pay in copays, coinsurance, or deductibles. If you use the UCSD hospital network, which we have 3 hospitals in our area with just about over 300 specialists that you could go see, your benefits will be payable at 90% for any hospital or diagnostic services, and you have a $10 copay to see a specialist in evaluation. They are also within walking distance, a shuttle ride away, or we can provide a Lyft or an Uber ride for you to go to that appointment. If you would like to go to a provider that's not affiliated with UC, you will pay a little bit more out of pocket. So we always encourage you to use our UC facilities, and you can use them throughout the state of California, not just here in San Diego. We do not mail out insurance cards. We offer an app that you can download to your mobile device, your phone, or your tablet, and that will provide a copy of your insurance card, the front and back of it. And you can also view claims as they're processed under your membership identification number. It also provides you links to different insurance plan websites if you want to take a look at your benefits under dental or vision as well. If you do have comprehensive health insurance from the US already, you may waive the health fee by filing a health fee waiver application on the Triton link between May 3rd and September 10th. If you miss the waiver timeframe, you will need to pay for the insurance for fall, and then you'll have an opportunity prior to winter and spring if you do decide that you want to waive it for winter or spring. We cannot retroactively apply a waiver for the fall, so once you've paid it, you are stuck with it for the entire fall. You are welcome to use the Student Health and Wellbeing Clinic here on campus, no matter if you have the school insurance or if you opt out. But if you do opt out, you will be financially responsible for all services that are rendered, and you will be required to pay the fees prior to leaving the clinic. If you don't pay them, we will transfer them to your student account, or that could affect your registration status. You may get a receipt that you can use with your home insurance to seek reimbursement. We'll provide all the coding and necessary elements for you to submit that to your insurance plan so that they can pay you back at the highest rate possible. If you have any questions or you need any paperwork, please contact us. We'll be glad to help you or guide you through the process. If you do waive the health insurance offering, I strongly recommend that you consider grabbing the RAFT option. It is the last question on the questionnaire for the waiver. It's not an insurance. It's basically a membership for you to come into the Student Health and Wellbeing Clinic here at UC San Diego and have scheduled appointments and in-house lab services at no additional fee. The cost for this membership quarterly is $70, and that's 3 times fall, winter, and spring. The spring includes the summertime. And you can schedule as many appointments as you'd like and have as many lab tests as you'd like for that $70 fee. You can use your health insurance outside of the Student Health and Wellbeing Clinic, and we will write you referrals or recommend different providers or specialists or facilities so that you can maximize your benefits under your insurance outside. And again, we will provide you with any kind of documentation that you might need to take to that provider. For those of you that are looking for online health plans that might cost you a little bit less money, that meet our health plan health waiver requirements, these are 3 trusted companies that a lot of our international students do choose to purchase plans through that do meet our requirements, and UCOP has approved these for the waiver. So you might want to take a look at that if you are looking for alternate plans that will save you some money. You still can come into the Student Health Clinic and have services. We'll create a receipt for you, but you will have to pay for the services up front and then seek reimbursement later. This is a picture of our Student Health Clinic here on campus. We are located centrally on Library Walk, right down from the Geisel Library and across from our Price Center food court. If you do have any questions, please contact us by phone or email or attend one of our offered Zoom sessions. And those are held on Pacific Standard Time, Monday, Wednesday, and Friday. We do have a lot of students that do log in after that time, but Please try to adhere to the Pacific Standard Time, and we'll be glad to answer you face-to-face. Please visit our websites. The URLs are provided there for you. If you want to take a look at our student health website, or if you'd like to take a look at the University of California Office of the President website, this will provide you with detailed benefits and how the offering works for the insurance. I appreciate your time today, and I look forward to seeing you around the campus. Thank you.
Thank you so much, Jill, for that important information for all of our students. So now I'm going to go ahead and pass it along to my colleague Annie, who will be talking about incoming health requirements for this year.
Thank you, Gabby, and thank you so much, Jill. Yes, I'm here just to talk about all of the UC San Diego incoming health requirements. And in fact, these health requirements are for all of the UC system, not just San Diego. Congratulations on your upcoming admission to UCSD. We're really looking forward to you coming. My team lead this, and so your submissions will be reviewed by a member of the nursing team, and so we look forward to receiving those. And I just want to talk a little bit about why the university has incoming requirements. It's really for protection of the community. And we certainly have seen that going through this pandemic, but there are also other outbreaks that occur in university settings, just from the sheer nature of being in congregate environments, so study halls and shared living spaces. And so we put a lot of energy into reducing the likelihood of vaccine preventable illnesses on campus and ensuring a good high level of herd immunity. What are the UC incoming health requirements? There are three, and I really call out COVID-19 vaccine as a separate compliance simply because it's new. But our first one and our longest standing one here at UC San Diego is the tuberculosis risk screening. So we need every student to be assessed for the risk of tuberculosis. The second one are regular immunizations. So that includes Tdap, measles, mumps, rubella, and varicella, and meningococcal vaccines for students under the age of 22. And then, as I said, the COVID-19 mandate. Now, the deadline for all of these requirements is July 11th this year. So starting the process. So the whole process starts by needing to log into the electronic medical health record where all students' health information is securely kept. And you will need your UCSD student AD login, which is your email that you're given for the university, and the password. You will be issued that. And then we regularly load students into our system. So I did see a question there. If you are getting a message that says we cannot find you yet, that's because we haven't started loading the fall 2022 students. For undergraduates, the links are on the Triton checklist, and for graduate students, it will be on the graduate division, which we will be updating this week. So once you are able to log into My Student Chart, you will find the incoming requirements actually on the home page, but there's several ways of getting there. The easiest way to remember, I think, is by going to the menu and then scrolling down to immunizations and screening. And that includes all three components. If you, there is also another way of entering your COVID-19 details, and you will also see it on that menu, and it will say COVID-19. So there are several ways that you can enter that. If you want to do your the regular incoming vaccines first and then come back and do an updated COVID-19, you can do that by choosing that second space. Once you get in there, this is what you will see. You will see TB screening, and that will link you to a short questionnaire that will assess your risk. If you are perceived as having slightly higher risk, and many students coming from outside of the US will be required to do tuberculosis testing, and I'll talk a little bit more about that in upcoming slides. And then there is the immunization history screening, and that does include COVID-19. And within there, you also will be required to upload a copy of your immunization records or a copy of our form. So the first requirement is the TB risk screening. And this is a series of questions and then prompting for testing. And the type of testing that we accept is TB skin testing or blood test. A chest x-ray is acceptable if you're unable to obtain those two, or you're doing a chest x-ray for other purposes. And once you upload the testing, a nurse will review that and they will contact you. They will contact you to let you know if you've met the requirement from testing, or if there's something additional needed. Sometimes there might be a point that needs clarification. And so I really do request that you go back and check in My Student Chart, which is the student facing portal, and we will send you messages and you can discuss any aspect of this process with you. For all of the incoming requirements, we do ask you to complete them as soon as you're able to avoid an enrolment hold. The immunization requirements, you will need to get your vaccine records, in whichever way is easiest to do that. You can use our immunization form to guide you, and that can be found within My Student Chart or on our website. You can take that to your healthcare provider to have it filled out if you need, especially if you feel that you might be missing some vaccines or you need some boosters. It might be best to go to a healthcare record. And again, please get onto this as soon as you're able to avoid a hold. The COVID-19 vaccine requirement is a newer requirement. This is the first incoming cohort. You are the first that will be required to do this, although all of our existing continuing students have been meeting this mandate. And so currently, and I say currently because anything related to COVID-19 is apt to change. As it is today, what you need is a primary series of vaccine and one booster dose. The vaccines that we accept are those that are approved for full approval or emergency use authorization from the FDA and WHO approved vaccines. And presently that includes Pfizer, Moderna, AstraZeneca, Covishield, Covaxin, Sinopharm, Sinovac, or Coronavac as its other name, Janssen and Novavax. And so any of those vaccines are fine, and combinations of those vaccines. We do have exemptions or exceptions available for religious and medical reasons, including pregnancy. And these vaccines will be available to you on campus. Our deadline is July 11th, but you will have a good part of the full quarter to get any vaccines that you need, including the COVID-19 vaccine. This is our exception and deferral process if you need one of these, and we have a specific workflow for this that sits external to My Student Chart. And I really just wanted to call the types of things that an exception or deferral will be issued for: certain disabilities, religious reasons, remote if students are studying remotely, and then medical reasons for if you have a contraindication or precaution, if you had an allergic reaction to a COVID-19 vaccine in the past. These things will all be considered. So when you're in My Student Chart, this is what it looks like over each vaccine. There's a little info bubble, and you can hover over that and it will provide you more information. And then it will ask you for the date that you received it. So you're really wanting to put your most recent dates. And you will see more boxes there than you will probably need or are required to fill in, but they're there in case you have needed to get a booster for some reason. It's just really a space. You don't have to fill every box up to be compliant. You will see on our website or on our form lots of information about what is accepted in each of the categories of the vaccines. In terms of getting help from us, the best way of doing that is sending us a message at Ask a Nurse, which is the way that you communicate within my student chart. There is a big box on the landing page, and that inbox is manned by all of the nurses and medical assistants that are processing your submissions. And so any questions or concerns, you can always message us there. That is the preferred way rather than calling or emailing. I do have an email contact there if you're having technical difficulties, but please do not send any health related information to that email because emails are a less secure way of sending health information. So we prefer to keep everything within my student chart. We have all of information and forms, etc. on our website. You will find anything you need on there, and also on the Graduate Division website. Specific to the COVID-19 vaccine, we have a website on campus called Return to Learn, and that really houses all information pertaining to any of the COVID-19 mandates, not just the vaccine, but any updates in terms of non-pharmaceutical activities that you're required to do, for example, masking and testing. It is a huge wealth of information, but there is a tab there dedicated to vaccination, including how you would sign up to get a vaccine when you come to campus. And I just want to reiterate to please return to my student chart to read messages from us, because sometimes students, you may have submitted documents and questions to us and we've responded, but you haven't seen the answer, and it might be that we require more information from you or clarity on your submission. So it's really important to return there to complete this process as promptly as you can. So thank you so much.
Thank you very much, Annie, for that information. We are going to open this up to our open question and answer portion now. We see some great questions coming through already, which is wonderful. Keep those coming. We will still be online to help answer those based on the information, the great information that was just provided. Before we jump into that, I just want to go over some reminders and deadlines that are coming up for our international graduate students. So just so you are aware of our upcoming pre-arrival webinars like this one, we have a whole host of those coming up this spring. On the 29th, our next webinar is going to focus on graduate student housing. April 5th, we're going to focus on teaching assistantships, so TA-ships, and English TOEFL requirements for those. On May 3rd, we're going to focus on graduate student funding. On May 10th, we're going to go over the CVIS transfer process, so more to do with visa paperwork. On May 12th, we will focus on student life and getting involved on campus. May 17th, we'll cover campus safety. And then on May 19th, we'll go over student accounts and finances. All webinars will be recorded and posted at iwebinars.ucsd.edu. I did want to address, there was one question that came up in Q&A about some access to the webinar links. Do note that it takes about 10 to 14 days for the webinar recordings to be posted. If there are any technical issues, if the link is not working or anything of that nature, please contact us at icontact.ucsd.edu. We can look into that if there are broken links. But do know that does take a little bit of time to get the recordings up there. And then some important deadlines and reminders for all of our students. If you haven't begun the process already, you can request your visa paperwork via the iPortal. I can go to iportal.ucsd.edu. You can also begin applying for on-campus housing at hdhgradfamilyhousing.ucsd.edu. Once again, our next pre-arrival webinar is going to focus on housing. That will be available, the registration at iwebinars.ucsd.edu, which is there already. And after that will be our teaching assistantship webinar. Again, that link is available on iWebinars. And then finally, new international student orientation. This is separate from graduate division orientation and department orientations, specifically for international students. That will be coming up in September. More details will be at iorientation.ucsd.edu. All right, so we're going to go ahead then and open it up to Q&A. There are a few questions that have come through that I see some have been answered, which is great. Some are a little bit more detailed, but there are some really good broad ones here that I think would be beneficial for the group to answer. So I'll go ahead and begin. Oh, sorry, I think I might have heard someone, I'm not sure. Maybe some feedback. Okay. So the first question that's come through, and Annie, this one I might direct toward you. The question is, if vaccine records are not available, can I show proof of immunity instead?
Yes, you can. You can obtain blood tests for measles, mumps, rubella, and varicella. There is no reliable test for Tdap or meningococcal. Yeah, but otherwise, yes, you can provide us with proof of immunity via a blood test.
Great, thank you. The next question we have here, this has to do more with admissions and visa paperwork, so I can go ahead and answer this one. The question asks, I'm graduating with my bachelor's degree in May, so I won't have a full transcript of my degree yet. Can I still apply for my I-20, or should I wait until I graduate to get the full official transcript? You do not have to wait. You can apply now. Everything, as Shauna mentioned, is considered provisional for now, of course, until you have your official transcripts. However, this does not stop you from applying for your visa paperwork. So you can go ahead and do that now, get started early so that you can, if you need to apply for your visa stamp, you can do that as quickly as possible.
Bobby, can I just jump in here?
Sure.
Related to this question that you just addressed, there is a person who said that they had degree conferrals from both a bachelor's program as well as a master's program, and they were asking if they only needed to submit the master's. And I just wanted to confirm that we need documentation for all any previous degree. So if it is your situation where you have earned more than one degree, or if you have undertaken graduate coursework at another institution, those should all be part of your graduate application, and we would want documentation for any previous graduate coursework.
Great. Thank you, Shauna, for clarifying that. All right, the next question we have here, I think again, we'll go to Annie, and this one is asking, currently our government is not allowing us to take booster doses for COVID. Only senior citizens are eligible for booster doses currently. Can you please tell us what can be done in this situation?
Sure. We would recommend, if you aren't able to access the booster, then please just document the two initial doses, one or two initial doses that you received, and then receive the booster in the full quarter. As I said, we have a big clinic running 6 days a week that you can sign up for and get that vaccine there.
Great. Thank you. And then another question here, a student is applying to UC San Diego, has gotten in, they are currently in the United States, so they're not overseas, and they're wondering, does that waive any immunization requirements? And connected to that, do most immunities, can it be detected from a blood titer test, as you were mentioning earlier?
What was the first part of the question, Gabby?
They are applying, or they are currently in the United States applying for their grad program here. So they're wondering if that waives any immunization requirements.
No, it doesn't. So these requirements are for all incoming students, regardless of origin. So the whole lot are required for every single student coming in. And yes, as I said before, you can definitely get a blood test to show immunity if you're having difficulty finding those records.
Great. The next question here, the student is saying that they don't have any documentation showing their immunization for measles. How can they fill out that information in My Student Chart?
Sure. So again, that you would just get a blood test and you can document the result of the blood test in My Student Chart. Alternatively, you could leave it blank, and if you aren't able to do that, and then we would follow up with you when we review your submission.
Great, thank you. And I know you covered this earlier in the presentation. I think we had some folks logging in a little bit later. Just some questions surrounding being able to log into My Student Chart, when they might be able to get access.
Sure. We usually start loading fall 2020 students starting in April, but I will talk to our IT department because we may be able to start doing that. But as I said, you can't get into My Student Chart without your UCSD AD login. So if you don't have that yet, then you wouldn't be able to get into My Student Chart.
Okay. Great. And then Jill, I have a question here that I think you might be able to help with. Someone is asking, they said they gathered from the webinar that insurance is not 100%. Also, as international students, we have to pay first and then get reimbursed. Is that correct?
So the insurance does not cover 100% if you're outside of the student health clinic. Generally, if you're seeing a UC provider, it's covered at 90%. You pay 10% out of pocket. If you're utilizing an Anthem Blue Cross provider, it's covered at 80%, and you may have a $500 deductible that applies. Take a look at our website at studenthealth.ucsd.edu. The benefits are detailed there and can probably speak to any individual or specific situation. If you're international, if you're taking the SHIP insurance through this school, you have those benefits. You don't have to pay up front. But if you are waiving the insurance requirement and you're utilizing services at Student Health, you will be required to pay up front and then seek reimbursement from the insurance company that you've purchased or that you have.
Great. Thank you, Jill.
Thank you.
And then Annie, I see there are a couple of questions here. One has a follow-up question from earlier. Is it a good idea to get booster dose in the US, as this way they'll be receiving multiple vaccines?
Yes, it's hard to know without knowing exactly what the original vaccine is, but yes, it's very, very common for people to receive different vaccines, even with US vaccinations. If you've received an international vaccine, the US vaccines are slightly more, well, quite significantly more effective. So it could actually offer you a lot more protection than you may currently have. So it's a very accepted and widespread practice within the US for people to receive different types of vaccines.
Mm-hmm. Great. And then a second question here, Annie. A student is asking, they said they got a COVID-19, they have had COVID-19 in the last 90 days and are not allowed to get their second shot and booster. How do they figure out this situation?
Sure. So the University of California, as part of the mandate, allows a 90-day grace period following an infection. What you would do is send us a message and we would put you on a list that would prevent any academic penalty from occurring. So that's totally fine.
Great, thank you. And just another question here. I just want to make sure for folks who joined us a little bit later, there's a question related to provisional admission and applying for visa paperwork. So yes, if you are provisionally admitted to UC San Diego, that still allows you to apply for your I-20. You don't need to wait for that provisional admission to change, once you've submitted your official documents, transcripts, or what have you. You can still go ahead and apply now for your I-20 documents so that you don't face any delays getting your visa and coming here. All right. So there's one question here for all of the vaccine deadlines. What if I miss the deadline of July 11th?
It depends which requirements. So the first set of academic holds go on at the beginning of August, and that's for tuberculosis. And then you have the majority of the full quarter to get compliant with all of the rest of the vaccines. And so primarily complete your tuberculosis first and then work on your immunization completion.
Great, thank you. There's one question here. Someone having difficulty accessing the recording from one of our first webinars. If you are having access issues, any problems with the link on our website, please contact us at iContact, I'll put that in the chat, .ucsd.edu. If that link is broken, we can go ahead and fix that. Just another message for everyone, do know that webinar recordings take about 10 to 14 business days to post. So if you're not seeing it there, that might be one reason why, but we do understand sometimes technical difficulties occur. If that is the case, again, iContact.ucsd.edu. Which I'll just put in the chat now, and you can contact us and we can look into that link if it is broken. All right. Someone is asking, can you please just cover the COVID-19 mandate requirement again briefly?
Certainly. So as it is of today, you need a primary series. So for most vaccines, that's 2 doses. If it's a Johnson & Johnson, it's a single dose. So that would be considered your primary, and then a booster at the appropriate recommended timeframe. For majority of vaccines, that's at 5 months. And so you would have been required to have the 2 primary doses and 1 booster dose.
Great. Thank you, Annie. All right, I'm just taking a look through here. This is a good question. So I have taken admission in the summer session, so they'll be arriving earlier than the fall. What will be the deadline for me for these immunization and health requirements?
I have to get. They will be the same, except the COVID-19 vaccine may have an earlier deadline date, which is still currently being worked on.
Great, thank you. All right, I'm just taking a look through here. Just know that if there are quite specific questions, we do ask that you contact student health directly, or if it's a very specific visa paperwork issue, please contact our office at either icontact@ucsd.edu or inewstudent@ucsd.edu. We can give you specific guidance on your case if you have detailed questions about your particular situation. All right. Okay, well, I don't see any other general questions. These were really, really great questions. Actually, there is one here that I'm hoping, I think Annie reviewed, and it's, is there a website that summarizes all diseases for which vaccines and immunizations are needed?
Yes, there is, and that is on the Student Health Services website, and there's a dedicated page which is currently being updated for fall 2022.
Thank you. All right. Well, we hope this webinar was helpful today. Thank you so much for your questions. These were great, and we hope that this guidance is helpful for you as you're navigating these different pieces to starting your program here this fall. We look forward to seeing you at our future webinars as well. Please, again, feel free to reach out to us if you have any further detailed questions. Our contact information is here on this page. Other than that, thank you very much. Have a wonderful morning, afternoon, or evening, wherever you might be in the world. Thank you all. Bye-bye.